today's World Insight, the state of New York, ground zero for the rapid rise of coronavirus cases and deaths. The lowdown from the NYC International Liaison.
The most important number for New Yorkers to know is 311. If there are any concerns related to discrimination and other types of harassment.
And public health infrastructure under heavy strain in coping with the coronavirus pandemic. A look at how international lenders like the AIIB help and the prospects of recovery from a London economist. Here is our host, Tian Wei.
Hello and welcome to World Insight from Beijing. I'm Tian Wei. We begin our show in the state of New York. The epicenter of America's coronavirus crisis reported a single-day fatality record on Wednesday with 779 deaths, breaking the record set just a day ago. The total confirmed cases in New York State approached 150,000 on Wednesday, with the whole nation reporting nearly 430,000. Officials warn Americans to expect worse numbers this week. But there are also encouraging signs, as numbers including the daily hospital admissions and incubations are down in New York State. Media reports did say that frontline healthcare workers in New York City, though, still lack protective equipment, and some are experiencing symptoms without getting tested. So what's the situation really on the ground in New York? For answers, I spoke to Penny Abeyewardena, the New York City's Commissioner for International Affairs. Let's listen in. Tell me more about the latest situation in the city of New York. I know a lot of challenges every day.
That is unfortunately an understatement. The situation is very dire in New York City. We are the epicenter of COVID-19 right now. We are working very closely with our state leadership, with Governor Cuomo, and under Mayor de Blasio's leadership, we are really trying to tackle the extraordinary numbers we are reaching here in New York City. It's almost exponential every couple of days. So it is a very dire situation right now in New York City.
Talking about the exponential number, how are the ICUs and emergencies of hospitals dealing with it? How are the sources of private and public hospitals being put together?
Yeah, you know, we have a very robust healthcare system right now, and they are heavily burdened. I will say, you know, through the work of my agency and in partnership with other city agencies, we are actively trying to recruit both medical personnel, but also get the PPE and the ventilators we need. We are running out of supplies, and it has been very important that we get the surgical masks, the N95 masks, the gowns that we need to protect our medical personnel. But the public and private hospitals are working together. We had 20,000 hospital beds. We are increasing it to 60,000. We need to increase it to 60,000 hospital beds, and we have had private sector partners like the Javits Center, the U.S. Tennis Association give their center in Queens to be able to create field hospitals, and that has been very important to add to the robustness of our hospital systems to provide the medical bed and care that New Yorkers need right now.
You talk about the earlier experience of your city trying to deal with such a quote-unquote war, as you earlier indicated. But sometimes it is with very limited resources. And also it is due to certain kinds of structural issue that you have to face when it comes to government. So tell me more about how, at the very beginning, the relationship between the city of New York, the state of New York, and the federal government, and what is going on now. Are some of the problems really solved systematically?
You know, the U.S. has you know, our federal system, but we've always had a very strong working relationship with Albany, with Governor Cuomo. The relationship between city and state is extremely important. I think politically, we've had some challenges with the Trump administration on issues related, for example, to climate change. You know, as the Trump administration pulled out of the Paris Climate Agreement, New York City was the first city that committed directly to it. Now over 420 U.S. cities are committed directly to the Paris Climate Accord. But at the end of the day, we are one unit. We are Americans. And so the relationship that the mayor has with the governor and with the president right now, it is about addressing COVID-19 and protecting New Yorkers and ensuring that we are able to, mitigate this crisis as it is happening.
On the other hand, you know very well there is a competition going on worldwide about procurement of medical supplies. So how is New York trying to do its part? What about that competition? And also, is federal level going to be any help to the city?
The mayor has a working relationship with President Trump and the administration. He speaks to them frequently. They have recently given quite a lot of PPE and some ventilators that we've needed. But we've also seen, and this is something that we have been working on for many years, but we've really seen the coherence of subnational leadership coming together and supporting each other. So the governors of Oregon, Washington, and California are loaning New York City ventilators. This is really something statewide that we're in together.
At this moment, when the pandemic and New York being the epicenter of it right now, there are also likely to be other challenges, Ms. Commissioner. If I understand right, there are reductions of budget in certain areas of New York City as a result of the overall budget cut for the city. How are you coping with all of these battlegrounds, in a way, at the same time?
Yeah, I mean, that's a great question. Mayor de Blasio and the administration had been very careful over the last few years in terms of our budget surplus, and so we were ready to take this on. These are some of the realities we're going to have to deal with as this pandemic goes on. Taxes in the U.S. have been pushed until midsummer, so cities and states aren't going to get the revenue that they have, and there is going to be a budget crisis. But right now, we are able to manage with what we have. We are also very determined to ensure that our school system, which has gone online for 1.1 million kids throughout our 5 boroughs, is functioning and is a strong source of education for our young people. We are focused on our food supply chain and ensuring that all New Yorkers have food and don't go hungry.
Yes.
The mayor recently announced Catherine Garcia, who's our Commissioner for Sanitation, as our food czar. So I believe that our priorities are all in the right place right now. Some of the questions that you're asking about long-term planning, we're both thinking about right now, and we'll share those plans. But really, this is very much about dealing, as the mayor says, we are in a war right now, and so we are waging this battle as it is happening to us right now, and it has been extraordinary to get the support of not only New Yorkers around our 5 boroughs really pitching in where and how they can, but honestly, the international community has just heard our call for support and have been doing that at exponential levels, which has been amazing.
When the crisis is going on in the city of New York, many around the world are trying to lend a helping hand. While at the same time, people are also expecting the city of New York to be responsible and also helpful for people in that city from various backgrounds from all over the world. Let's listen to the next part of our interview.
We are host to the largest diplomatic corps in the world.
Indeed.
I have been in touch and I have been in touch with my colleagues throughout different missions, including your Chinese ambassador to the UN and the Consul General of China. The city of Shanghai gave us a really generous donation of K95 masks, but we've also had other governments like Qatar make significant donations. The United Nations gave a historic donation of 250,000 surgical masks from their own stockpile on UN headquarters campus. So we have really seen the international community not only reach out to us to show their solidarity, but really give and donate to the community that has been serving them from a diplomatic perspective for decades. So we are seeing the global community come together and support us. And it really is extraordinary what is happening on the ground in New York City right now.
Ms. Commissioner, it is no coincidence that in pandemic or in crisis, people will see sometimes the rise of finger pointing and racial discrimination. for a city like New York, which is a very international and diverse one, you yourself is coming from maybe a family of various sources, right, of different cultures. So how are you dealing with that? How to avoid this thing spoil out of control, particularly when you have some of the federal officials making remarks that's not very helpful?
You know, the issue of discrimination and harassment has been something that we have been addressing since the beginning of this crisis. We have a Commission on Human Rights, which we have an absolute policy against any harassment or discrimination based on perceived notions of where this virus came from, and just, you know, discrimination against the Asian communities. We have services. We are prosecuting any sort of harassment around this. We are ensuring that New Yorkers have the tools necessary to ensure that they know who to talk to and who to call if they are feeling harassment or any sort of fear based on this sort of racial discrimination. The most important number for New Yorkers to know is 311. If there are any concerns related to discrimination and other types of harassment, if they call 311, they will be directed to our Commission on Human Rights to ensure that they get the necessary legal and other support that the city is providing. I also want, you know, to share that, you know, mental health is going to be a significant challenge as people are having to shelter in place and stay at home. And we have a very robust mental health program called Thrive. This has been a priority of Mayor de Blasio and the First Lady Charlene McCray since 2014, quite honestly.
911 probably was the latest, the biggest disaster people could recall about the New York City, but now this pandemic being the epicenter of it. So what do you think, even out of your own personal experience, what have you learned through the experiences of going through the crisis like these? And what does it mean for you personally? What does it mean for your relationship with your beloved ones? What does it mean for your relationship with your beloved city?
Yeah, that's it's a great question, because we've not only survived 9/11 recently, we've also survived Superstorm Sandy. So New Yorkers have gone through a lot, and what I will say that I've learned is that we have extraordinary resilience, and I also like to think that we learn from these experiences. Not only is there resilience of New Yorkers, but we're also learning, you know, lessons. We need to strengthen our health systems. Right now, something that we're going through in New York City and throughout the U.S. is our census. And something that's very important about our census is that this is how the federal government allocates money for healthcare systems, for education, for infrastructure like roads. And so right now, while everybody is sitting at home, I hope they will take the census, because all of us need to be counted. If we're counted, we get the money that is needed to build the infrastructure that we need to thrive. And so I think all of this is going to end up, personally, it just makes me love New York City even more. I am right now currently sitting in the middle of the epicenter. I'm on the Upper West Side in Manhattan, and I hear ambulances all day, and I'm, you know, talking to people and trying to ensure that we are getting the support that we can get from the international community. I have colleagues throughout city government that are doing everything that they can to protect our community and address this pandemic. And quite honestly, that just makes me proud to be a New Yorker. It makes me proud to be an American, and we're going to come out of this stronger than we were before.
Our exclusive interview with Penny Abe-Mordena, the New York City Commissioner for International Affairs. You're watching World Insight, still to come on our program. Public health infrastructure under heavy strain in coping with the coronavirus pandemic. How can international lenders like the AIIB help? An AIIB executive talks about that and more right after this break. The Asian Infrastructure Investment Bank, or AIIB, said on Tuesday it had approved its first emergency assistance loan of more than $350 million to China to help fund efforts against the COVID-19 pandemic. The aim is to beef up the public health emergency response capabilities in the Chinese capital of Beijing and also the megacity Chongqing. These include upgrading their centers for disease control and prevention, improving the epidemic emergency response of hospitals, and providing vital equipment and supplies to frontliners. For details about that, I sat down with Sir Danny Alexander, the Vice President of AIIB. He told me that the loans to China is only the first of its kind. Tell me more about how is this decision come into being?
Well, AIIB is a multilateral bank to support infrastructure, and many of our members, starting with China, would like AIIB to be able to help in this emergency situation, and we want to do whatever we can to support members through this crisis. So the first thing we've decided is a $355 million loan to China to support emergency healthcare infrastructure. That will help to support healthcare infrastructure, public health infrastructure in Beijing and Chongqing. And we see that as being something which can help China with the response to the virus.
When you come to healthcare infrastructure, we're talking about a lot of possibilities, and money, even as big as you just mentioned, could be, very much just a drop of water in the sea. So how does that work?
Well, we take the lead from the client, in this case the government of China. They were keen to have AIIB support for some quite specific things. In Beijing and Chongqing, both of which are major population centers with a lot of people moving back and forward, it's especially important to have strong public health infrastructure, strong monitoring, a center for disease control, and then the equipment that needs to go with that. So not only hospitals, but also ambulances, protective equipment, all the things that are necessary to ensure a very good response to the virus and to, in future, keep the virus down.
This is going to be a brand new experience for AIIB, I would assume. Earlier, you were mainly working on, infrastructure in terms of building bridges, factories and things like that. But this time, it's going to be different.
Well, this is our first healthcare loan.
Exactly.
But look, one of the things we want to be as a bank is flexible and highly responsive to what our members need. And in this crisis, our members need healthcare infrastructure support, and they need support with the economic effects of the crisis. So the loan to China will just be the first of many crisis-related financings to AIIB member countries. At the moment, we're working on support for India, working on support for Indonesia. But the truth is, almost every country in the AIIB's membership is affected now by the virus and by the economic effects of the response to the virus. And so many of those countries, especially the developing countries in Asia, will come to us, and we can learn a lot from the Chinese experience and from the loan we've made to China to help us do a better job for the other members of the bank who need our support today.
Let's just throw in some examples. We talk about building healthcare infrastructure. Was there any recent experience over the past few decades of that in any country that could use as reference for us right now when we are dealing with a global pandemic, when we are trying to build a healthcare infrastructure for a global pandemic outbreak time?
A number of countries have already good control systems for monitoring outbreaks, for sharing information, centers of disease control, this kind of thing. And so part of our lending to China is about helping to invest in that system for the future. We know that intensive care facilities and hospitals, ambulances, having the protective equipment, all those things are crucial because you have to be able to protect the healthcare workers. Because if the healthcare workers themselves get infected, they will suffer, but also they're not then available to look after other people. And so, that has to be part of it in order to make sure that the infrastructure and the equipment that you're financing can be used as effectively as possible by the healthcare staff.
What do you think, Sir Danny, what China did over the past few months, whether it's prevention, control, treatment, and mitigation regarding the pandemic, will have its reference to your other members, particularly when you're approaching, as you just said, trying to build healthcare infrastructure projects?
Well, I think many countries will look at how China tackled the virus and learn lessons from it, and look at what worked and look at mistakes that were made and try and make sure that they can learn from those lessons. But I think the real challenge comes in the less developed countries where the healthcare system is not so strong, where the monitoring and disease control systems are not as strong as they are in China or in other countries. And so I think it's in those cases where support from the AIIB, coordinated with other international bodies, can be really helpful to ensure that countries with weaker systems can build those systems quickly to help them respond better to the virus in the right way.
So this is a race against time, isn't it?
For sure.
As we speak, things are happening every day, changing.
Every day around the world, the effects of the virus are spreading. Of course, sadly, many people are dying or being hospitalized, but also member countries and countries all over the world have decided to really slow their economies right down in order to give them the best chance of controlling the virus. And so one of the other issues for institutions like the AIIB is to help those countries in this period of slowdown and then to be able to recover quickly afterwards, because that's what's going to be crucial, not only to the health systems, but to the health of economies too, after the immediate crisis is passed.
So you are also dealing with multiple crises going on at the same time. On the one hand, help with the healthcare infrastructure. On the other hand, how to deal with the economy, which is going to be having a huge impact on every one of us.
Absolutely right. So last week we announced that we're setting up a crisis response facility. That's a $5 billion facility which will offer support very flexibly to member countries who are responding to this crisis.
What do you mean by flexibility?
Well, it means, just like you just said, there are healthcare needs. There are needs in other economic sectors, infrastructure, manufacturing. So each member will have the best understanding of where the support needs to be focused. And so the facility is flexible in that it can respond to healthcare needs, but it can also respond to other economic needs, really according to the specific circumstances of each country. And the idea is to be able to respond very rapidly. So the loan that we approved for China, that was put together in a few weeks, much faster than normal, precisely because you want to respond quickly to the emergency.
And will that speed up even more, because we have seen things are happening again very quickly elsewhere in the world?
Well, we're already having conversations with more than 20 members who've come to us already to say, can you help us? We have the people, we have experts in different areas who can handle those conversations. We have a good understanding of the sorts of things that we can do, not least learning from this first loan in China. And so I'm quite confident that when the members come to us with requests, that we'll be able to respond to those quickly and efficiently, and that's certainly our objective. I think the other aspect is that it's really important that the global community has a coordinated response to this. So we've been working very closely with the World Bank, with the Asian Development Bank, with the IMF and others to really coordinate, because of course each institution will be able to do very specific things, and so we have to all play to our strengths. We have to all move quickly, and we have to work closely together, and that's what we're doing with other international bodies.
Certainly, as you may know very well, probably much better than any of us, that this is a difficult time. People are talking about comparison to 2008 and 2009 financial crisis, and people are even talking about to the 1930s big recession, without knowing at this moment what it is. But how is AIIB likely to prepare for the worst, hope for the best, though? I mean, resources are limited when an economic crisis comes. So how to use money smartly and more efficiently?
You know, I was very involved in the response to the 2008 financial crisis.
I remembered.
And you know, this could well be more severe in terms of its economic effects than that. That's what some of the forecasts are saying. I think the key thing for AIIB is that we have a lot of financial capacity, and we need to be ready to use that financial capacity flexibly and quickly to respond to the needs of our members. And so it means we have to talk very frequently to the member countries, work out what they need and what we can provide, and stand with them. You know, I think the key thing about our institution is that we will stand with our members, we'll help them through this crisis, we'll work closely with the rest of the international community to coordinate. And I think it's that international coordination which is really powerful to give the world the instruments it needs to help get through this crisis.
This brings a big question mark to AIIB because you are also dealing with a huge number of developing countries. It takes long time to establish a very well-established healthcare system. You can't do that in one day.
You can't do it overnight, that's true.
You can't do that just through the healthcare infrastructure project. But people are going to look at you, AIIB, say, oh, AIIB is important, we know that, so help us, do something. After you're doing it, it might not necessarily going to be reflected immediately. So that means a lot of pressure for AIIB, I would assume.
Well, look, we have to play our part.
Yes.
We have to play our part in the international response. We have to do our bit to help countries. But we also have to work in partnership with other institutions. So, you know, the World Health Organization is given the remit by the international community to work on health issues. So we have to work in partnership with them, listen to them about what's needed. Do the same with other international institutions. AIIB does not have all of the wisdom about every subject. In fact, we're trying to be a lean organization, which means we want to work in partnership with the relevant experts in each sector. And in healthcare, that means partnering with the right organizations who can help us in those areas. But what we can bring is the financial capacity that we have, the knowledge we have about infrastructure, the ability to move quickly and to mobilize resources to help member countries.
Before this pandemic broke out, we saw some signs of geopolitics being played around. Now we also saw finger-pointing, blaming games in the middle of the pandemic. So, Sir Danny, how is this going to have an impact on AIIB's work, which is a multinational platform?
Well, as we've discussed this before, AIIB is a non-political organization.
Exactly.
We don't get drawn into political disputes.
Can you prevent it from happening? I mean, people
we
are
can't.
trying to grab whoever into politics, into geopolitics.
Of course there will be disputes, and that's between countries to work out for themselves. What we can do is help those countries to work together through the AIIB for the purpose that the AIIB was set up, which is to invest in infrastructure that supports sustainable development. In this case, to deliver a rapid response to support our countries in this crisis, to be flexible and imaginative and innovative in how we do that.
What about the future source of funding for AIIB? Now, Sir Danny, we're going through a difficult time, and every country is trying to make sure they have enough resources for their own people, meaning that there will be less possibility or pool of funding for AIIB. What do you make of that possibility?
You don't need to worry about that.
I don't need to worry
about that because AIIB capital from countries, their contributions have already been paid in, and we don't need to go back to the members asking for more money. We have the money they've paid in, and we use that to finance projects. We issue bonds in the markets to finance projects, so we don't have to go back to our members and ask for more money. They've already been very generous in their contributions, and now we have to make that money work for them in this crisis. That's our job.
Sir Danny, you went through the financial crisis. You play a very instrumental role during that period of time, helping your home country at that time, the UK, to weather the storm. What was your personal experience like, and how do you think it could apply today when you are facing your job here at AIIB, and also to share with others who are watching this program, you know, what does it take to go through a storm? And in retrospect, what really counts?
Well, I think that maybe two things from that time. The first is that there was a very strong sense of global common purpose and countries working together to have a coordinated response. Led by the G20, when Gordon Brown was Prime Minister, he did a superb job in that respect. And so having the G20 come together again, as it did in Saudi Arabia recently, to coordinate and to put forward ideas is an important part of this. And I think global coordination is crucial. That's where institutions like ours can play a really valuable role. The second thing is that the crisis itself may be over in a matter of months or a year or two, but it takes a lot longer than that to deal with the consequences. And so, you know, we have to be willing to work together for a long time to help minimize the consequences, deal with the consequences, and support countries to get back on their feet and economies to get going again once the healthcare emergency is dealt with. And of course, the healthcare emergency, as we know, will take some time to deal with. But even beyond that, the economic effects will be with us for much longer.
continues to grow over the long-term economic damage from the coronavirus worldwide. The pandemic has dealt a severe hit to growth, with G20 leaders pledging to inject trillions into the economy. Now, talks over how to bring the economy back on track are under the spotlight. Will economic growth bounce back after the outbreak? Earlier, I spoke to Jin Ke-yu, professor of economics at the London School of Economics and Political Science. Let's hear her views. Let me start by asking you about the $5 trillion committed by leaders of the G20 economies. How likely it is going to solve the problem, and how big is the problem?
Well, without the $5 trillion, we are sure that the world economy would be in a much worse place. I have my doubts about the effectiveness of monetary policy and more enthusiastic about fiscal policy, especially well-targeted policies to help the households and help the businesses. This is not something that the monetary policy can do very effectively, because you can't force people to go back to work. And right now, the unemployment rate around the world is high precisely because of social distancing.
Yes, indeed. We see that spike in the United States over the past few weeks, unprecedented for decades. But is this going to be temporary, or is likely to be a very quote-unquote sustained process, which of course is a much bigger problem?
Well, it really all depends on how long this pandemic will force people to engage in social distancing. So it really depends on the virus. The virus sets the timeline. Different countries have taken very different approaches. So in China, they had a very dramatic and draconian lockdown. So the economy suffered heavily for more than a month, but now it's working its way back to normality. Now, other countries like the U.S., like many countries in Europe, are taking mitigation measures, which is only about delaying the peak to relieve some of the pressure on the health system. But that could also mean that this kind of social distancing and economic paralysis can last much longer, maybe 6 months, maybe even longer. In that case, this is not just a temporary shock. This will lead to a very severe economic downturn.
Having said that, though, I've been reading some of your latest articles regarding the status of the world economy. Professor Jin, you talk about this is in comparison to the earlier big recession or Great Recession back in the 1930s. However, we also heard from some of the other experts who disputed about that opinion. Tell me more about what you think, Professor Jin.
Well, this is not really like the Great Recession of 2008. It's not a financial crisis. This is a direct hit to the real economy. Service sector as a share of GDP in the United States is 80%, and it's as high in other advanced economies. So even if you have half of that stopping in complete halt, that's 40% of GDP. And so it really depends on how long we think this episode will last, so that people can't go to restaurants and can't go to the movie theater. The restaurant business alone is close to $1 trillion business in the U.S. In the financial crisis, the banking crisis, the credit was frozen, and you can use monetary policy to jumpstart credit, jumpstart borrowing, and then people start to consume, and the economy goes back to normal. But like I said, monetary policy can't get people back to work, because it's the virus that is the hurdle. So it really all depends on, is this a 6-month thing? Is this a 2-month thing? In which case it's a mild crisis, or is it potentially even longer, in which case the economic downturn we see is potentially as large as the Great Depression. Although I believe, and I'm confident, that now the competence of the government is to stimulate and to ease credit, and so that can mitigate some of the longer-term consequences that the Depression suffered from.
Some of the sectors of the economy now, for example, online-related sectors are doing pretty well. Meanwhile, some of the real economy industries are also trying to go online ASAP as we speak. So will this trend be able to help us getting out of this very difficult time, at least temporarily? Is this enough to be able to boost the economy?
Online activities are, of course, a compensation to the halt and stop in the real economy, but it by no means fulfills the gap, fills the gap. We're talking about face-to-face services, barbershops, cinemas, restaurants. Those are not online activities, and those are still the most dominant sectors. And countries vary by how much their activities are online. Now, it certainly has accelerated the trend to move a lot of activities online, but different countries are ill prepared. In Britain, my friends and my colleagues' children are homeschooled. They don't have an online education system, especially the younger ones. In China, they moved that entire system within 10 days online for kids of all ages. And so it's very, very different across countries. But even in China, I'm sure it has spurred even more activities, even more engagement online, but that's still a small share of the overall GDP. So I wouldn't count on that alone.
What is your analysis of the future trend of change in terms of global supply chain? Now, China out of the fire, will it be back on track in terms of its original role in the global supply chain, Professor Jin?
I think this is actually an opportunity for China. It's an opportunity to also kill the decoupling theory that has been holding sway among the hawks. And the reason is that China right now is gaining back speed in terms of normal business activities, as well as logistics, production, and supply chains. It is the moment for China to guarantee to the world that it will not cut off key sources of exports, key parts, to service the world economy. It is China's opportunity, and I think that this is the intention of China to stabilize not only financial conditions in the world, but also global supply chains when the rest of the world much needs the help. I do, however, think that this pandemic may even accelerate the deglobalization and protectionist trends that we had already witnessed before the virus. But things could also move in a very different direction, where China really gains a lot of trust and becomes a really reliable contributor to global supply chains, as well as many other kind of leadership in the midst of this crisis.
Professor Jin, it's an interesting phenomenon, isn't it? When China was in the fire, I mean in the middle of this pandemic, the rest of the world was looking for supply. Now, China is back in the court. However, the demand somewhat has gone, except a few sectors, for example, medical supplies and things like that. So there's always an imbalance between supply and demand. And how is China likely, according to your knowledge, work out this almost unresolvable question mark?
Well, first of all, I think what we are lacking in the world right now is a policy regulatory body. So trade will be hampered, but unnecessarily so. So even though world demand from a consumer's perspective is declining when China is just going up, there is this need and fundamental a demand for production supplies to continue further, but there's no regulatory body. But even inside China, the huge demand for business to continue operation and normalize still means that China needs to push ahead and restore all of its supply chain and components. And we've heard recently from Korea and all parts of other world thanking China for guaranteeing the parts that they so critically need.
Talking about the change of the economy, Professor Jin, some also argue, so it is the real economy that are being hurt right now. So why do we still put in so much cash and energy in order to save the stock market? You see that practice everywhere in the U.S., in some of the other major economies as well. So isn't this a very wrong logic?
Well, monetary policy at this point, the main goal is to ease credit, make sure that credit flows, that there's liquidity in the system. This way, businesses can borrow, they can still employ their workers, or at least give them the wages. And once credit is frozen, then we're really going to head towards the Great Depression era. So monetary policy is about having that liquidity in the system. Now, some of that will end up in the asset markets and stock markets, and that's just a byproduct. But also, stock market is also very important because it's about confidence. Once you have huge volatility, uncertainties, people become even less confident, and they are they're going to consume even less. And so maintaining the stability of the sentiment is also important, although that was not the main goal, the stock market. It was about really having credit in the system and avoiding a paralysis of the financial system.
Now, What would be the problems you worry the most, Professor Jin, before we wrap up today's discussion? From now until, let's just say, 2 months from now, what are some of the specific indicators you are going to read most closely?
Well, first of all, I worry about the large number of casualties that are the results of these mitigation policies pursued by industrialized Western countries. The delay in response and the less than severe social distancing measures can result in human lives being lost. That is not the ordinary financial crisis. Second, I worry about how long this will take for countries to be able to really contain or even just mitigate the virus to the numbers are low enough that people can go back to work. And third of all, I'm mostly concerned about lots of lives and lots of problems in developing countries, and I don't think that there has been enough emphasis on having these leaders around the world help them battle this common enemy.
I'm afraid there are so many front lines they have to follow all at the same time, including fighting the fire at home and also see together how collectively things can be done. Professor Jin Ke-yu, a professor of economics at the London School of Economics and Political Science, really appreciate it. Thank you so much, and welcome back to China.
Thank you. Good to be here.
Professor Jin Ke-yu on the latest economic assessment. And that's all we have for today. To find out more, you can always find us World Inside CGTN into your search engine or check out our YouTube channel, our Twitter and Facebook accounts. I'm Tian Wei on behalf of the team. Thanks for watching. Bye for now.